This video provides instructions for using the 3M Bair Hugger Full Access Underbody Warming Blanket, model 63500, and is intended for clinicians only. The 3M Bair Hugger Full Access Underbody Warming Blanket, model 63500, assists healthcare professionals in managing patient temperature in the perioperative and other clinical environments. The blanket can be used with adult and pediatric patients, and it provides clinicians with full, unrestricted access to patients in a number of surgical positions. Prior to use of the 3M Bair Hugger temperature management system, consult detailed product indications, limitations, safety information, and instructions in the provided instructions for use, operator's manual, and preventative maintenance manual. The 63500 warming blanket is often used in operating rooms to help prevent and treat unintended perioperative hypothermia. When used in the operating room, the blanket should be set up on the operating room table before the patient enters the room. To set up the blanket using a draw sheet for a patient in supine position. First, remove the blanket from the pouch and unfold it on the operating table. As you unfold, remove the clear head drape and set it aside for later use. The sticker at the head of the blanket indicates which end is to be placed at the head of the bed. The blanket should be placed with perforations facing up towards the patient and with the adhesive strips side down. Ensure that the head of the blanket extends 6 inches beyond the operating table pad. Once the blanket is positioned, use the adhesive strips to secure it to the table. Tuck the blanket's side flaps under the mattress or operating table pad to provide stability. Finally, tear open the perforations along both sides of the blanket. Lay the draw sheet across the midsection of the blanket, placing the sheet through the perforations on each side. The perforations can also be used to secure a safety strap around a patient. If a draw sheet or safety strap is not used, omit the step of tearing open the perforations. The blanket is now ready for the patient. When a patient is to lay in a supine position with arms tucked, first transfer the patient to the operating table, ensuring that his or her head is positioned on the head area of the blanket. Then, to tuck the arms, bring the draw sheet over the patient's arms and down through the side perforations. Tuck the ends of the draw sheet securely under the table pad. Make sure to follow your facility's specific procedures for tucking arms. If a patient is intubated and ventilated, position the head drape over the patient's head and neck. Do not allow the head drape to cover the patient's head or airway when the patient is not mechanically ventilated. If placing a safety strap, ensure that it is placed through the perforations along both sides of the blanket. If a patient is to be in supine position using arm boards, before placing the patient on the blanket, open the side perforations. Once the patient is on the blanket, extend his or her arms through the open perforations and onto the arm boards. Similarly, for a patient in a lateral position, open the applicable side perforation and then extend the patient's lower arm through the perforation. Position the patient's upper arm on top of the blanket's side channel. When a patient is to be in a prone position, before placing them on the blanket, open the blanket's side perforations and tear out the circular face section at the head of the blanket. Lay the patient so their face aligns with the hole in the blanket's head and extend the patient's arms through the side perforations. The 63500 warming blanket includes fluid outlets, which allow excess fluids to flow through and away from a patient to the pad or sheet underneath the blanket. This helps minimize fluid pooling on the patient's skin. If fluid runoff is expected, place an absorbent cloth beneath the warming blanket. Once the patient has been properly placed on the warming blanket, it is time to begin warming therapy. Remove the hose port card from one of the 2 ports found at either end of the blanket. Place the card in the unused blanket port. Insert the hose of a Bair Hugger warming unit into the chosen port using a twisting motion to ensure a snug fit. A visual marker around the hose's end guides the depth of insertion. Support the hose to ensure a secure attachment. Connect the warming unit to a properly grounded power source. Select the desired temperature and fan speed. If you have questions, refer to the warming unit's operator's manual. To end warming therapy, depending on the model of warming unit, either turn the unit off or switch to standby mode. Disconnect the hose and discard the blanket according to hospital policy. The following are important patient monitoring recommendations for the 3M Bair Hugger temperature management system. Continuously monitor a patient's core temperature. In the absence of continuous monitoring, monitor the temperature of patients who are incapable of reacting, communicating, and/or who cannot sense temperature a minimum of every 15 minutes or according to institutional protocol. Monitor cutaneous responses of patients who are incapable of reacting, communicating, and/or who cannot sense temperature a minimum of every 15 minutes or according to institutional protocol. Adjust air temperature or discontinue therapy when the therapeutic goal is reached, if elevated temperatures are recorded, or if there is an adverse cutaneous response in the warmed area. As with any device, it is important to read and understand the detailed instructions for use and safety information. This device is restricted to sale by or on order of a licensed healthcare professional. If you have product questions, please contact your local 3M representative. Call the 3M Healthcare Customer Helpline at 800-228-3957 or visit our website. 3M offers device training upon request.